So I'm Rachel Allan. I'm a Gamilaroi woman from Tamworth in northwest New South Wales, but I've lived and worked on beautiful Darawal country in southeastern Sydney and on the south coast for the last 8 years. So I started working down here as an Aboriginal health worker, and I currently work with the Cronulla Sharks, running the Deadly Choices program and working in my capacity as an Aboriginal health practitioner.
Tell me, what made you want to become an Aboriginal health worker, Rachel?
Growing up, my mum worked at the AMS, so she wasn't in the clinic, she was in the admin side of it, but so we were really familiar with the AMS. I've had a lot of aunties, great aunties that have worked in Aboriginal health before. When I first moved to Wollongong, I got a job at the AMS as reception, and just being around the Aboriginal health workers and practitioners down there was something I was really interested, seeing how they got to work, and I was doing a bit of admin for the allied health clinics. So something I wanted to do, and then I got offered to step in to do a secondment for someone in the chronic care position. So I took that up, and they supported me through my Cert 4 and my training and got me qualified.
How does it feel now to be able to have an impact on other mob and their health outcomes?
Yeah, I think it's really good, especially the last couple of years with COVID, just being someone that mob have been able to trust. I mean, Aboriginal people, we have this historic mistrust of the medical system for good reasons. So just being able to be that person that can advocate for people, and when they're a bit afraid or maybe a bit embarrassed to ask questions and not really understanding, just to be that trusted person that can kind of go between the medical system and just community and give educated answers instead of people finding out all their information off Facebook, but still doing it in a culturally appropriate way, breaking it down so that people understand, not making them feel stupid because they don't understand medical lingo, and feel supported and empowered to attend the appointments or get the vaccine or get their health check, whatever it is.
Do you feel like you have an impact?
Yeah, I do. And funnily enough, I probably didn't notice it too much until I had to do it for my own family. So my pop was recently had to go to RPA. So he traveled from, Corinda, 7 hours away, to go to RPA. And it was, it's a complicated system, the medical system. So until I kind of, I knew I was doing it for other people, going to their appointments, getting transport, making sure their EPCs were up to date. But until I had to do it for someone that was related to me and that I really cared about, I noticed how much of a difference it really made for my family. So that's probably when I started to feel the impact. And then, like I said, in COVID, just people reaching out, knowing that I was the person that people were comfortable reaching out to, was a nice feeling as well.
Tell me a little bit about what you do with the Sharkies now.
So I'm the Indigenous Programs Coordinator here at the Sharks. My primary role is facilitating the Deadly Choices program here. So Deadly Choices has been really successful up in southeast Queensland for the last 10 or 11 years. We're kind of the pilot program here in New South Wales. We've been running here in the last 2 years, which has been really interesting because of COVID. So that, the program was designed to work with schools and Aboriginal community groups, educating people about, chronic disease, healthy eating, how we can prevent chronic disease, why we shouldn't smoke, why Aboriginal people are more sort of impacted by all these health concerns, and then encouraging them to go and get their health check every year. So then obviously, because of the last 2 years being what it was, we also had a lot of vaccine promotion or addressing vaccine hesitancy in that. So yeah, I was brought on to go and do the role at the schools, but there's no AMS here in the Shire. So then I also became, because of my skills as an Aboriginal health practitioner, was able to work with the medical centre we were working with to be that trusted person for people to come in and do their health checks with. I think AMSs are amazing at doing health checks because we're usually Aboriginal health workers working with other Aboriginal people, but here in the Shire, there's maybe not so many Aboriginal faces at the medical clinics. So the job also then kind of morphed into being the one doing the health checks instead of just the one promoting the health checks. And, we use the Sharks or football as an incentive to be like, hey, not only do you get all these great health benefits, but we'll also, offer free tickets to games or meet and greets with the players. We've got 6 Indigenous players in our first grade team here at the Sharks. So good role models as well for our kids to look up to. And not just our Indigenous players, but all of our team is really interested in deadly choices. So, they're happy to visit the clinics, have the kids there if we're doing health checks at the field, or, they'll promote if they've got their health check or got their vaccine. They're happy to promote that for us.
What does it mean to have a national day of recognition as an Aboriginal health worker?
I mean, it's something that I think I'm proud that we have it. I know, Aboriginal health workers are, known about and respected in AMSs, but maybe not so much in the mainstream medical community. People don't really know who we are, what we do, or what skills we can bring. So I think having that day of recognition for people to understand, yeah, we work with Aboriginal people, but this is also how we can benefit the service. We have these different Medicare billing items. We have a different skill set. We have this trust and rapport with our community already. So yeah, just having that acknowledged, I think, is really important. I think we kind of think of, doctors, nurses, health workers in the hierarchy, but, we aren't actually bottom of the ladder. We're the ones keeping everything together a lot of the time. So just recognizing that is really nice.
What do you say? What's your advice to young people who are considering becoming health workers, practitioners?
I would definitely say go for it. Most workplaces, especially if you're in an AMS, are really supportive of you taking time off to do the training. I've worked with some really amazing doctors and nurses who have taken the time to teach me what they know. So then it's just enhanced my skill more. But I think I might be like even a prime example of just you're not just limited to the clinic. Like once you become an Aboriginal health worker or practitioner, there's so many other doors that open up for you, whether that's working more out and about in community, whether that's being involved in a sports team, whether that's working in schools doing health education. You're not just confined to a clinic every day. There's so many options out there once you get that qualification.
Oh, that's great. Look, thank you so much. Really lovely to yarn with you. Thank you.
Yeah, thank you so much for taking the time and reaching out.
Not at all. No, good to have a chat.